proposal that we approved last week. We just the path kind of crossed on that. So we were glad to get that withdrawn. And I think we're about to be live. I'm still looking for Secretary Gillespie. Did you call in? I think she will be joining us, and she has an update from last week. Oh, good. Dr. Smith's here. Didn't expect to see him today. Actually, I did expect to see him. It was, we have Gina on for Johnny Key, for Secretary Key. Gina, do you want to introduce yourself? Hi.
Hi, I'm Gina Wendell. I'm Chief of Staff for Johnny Key at the Department of Education.
Thank you so much. We appreciate you joining. Apologize for that confusion on my part. Okay, I do see a couple more. Representative Gray, did you call in? How about Senator Wallace? Okay, and Cindy's calling in right now. Okay, well, let's go ahead and get started. The CARES Act Steering Committee, I will call the CARES Act Steering Committee to order. I appreciate everyone being here. In the room, we have Bill Gossage, Dr. Greg Bledsoe, Representative Lane Jean, and also Representative Andy Davis has joined us related to one of the proposals that we'll be hearing from a little bit later, the proposal 4B from the University of Arkansas College of Engineering. We also have I think all of the committee members have joined. We might have been waiting on just a couple more of our representatives, one senator, one representative, but we'll hear from you, I'm sure, as we go on. So has the committee had an opportunity to review the minutes? And I had one correction. I think I accidentally left a highlighted portion of the minutes in the draft, but I will remove that for the final version.
Motion to approve the minutes.
A motion to approve by Representative Jean, second by Dr. Bledsoe. All those in favor?
Aye.
Aye.
Thank you. Any opposed? Minutes have been approved. Thank you. Now, moving on to the excitement, the great information from Secretary Larry Walter. We have an update on the standings of what monies we have approved, and we have a couple of great charts that I had sent out to you guys this afternoon, and hopefully you were able to see those after I correct my first mistake. There they are. Okay, Secretary Walter, are you ready for the charts, or do you want to talk first?
Yeah, Lola, let's go ahead and put the charts up.
Okay, thank you.
We're going to present them a little differently than the last time. I will answer any questions that you might have concerning any specifics. I'd still, oh, there they are. The first chart is that's not the one I want. I want the first one, which has 6, 10, 20 on it. Yeah, that one right there. This is a pie chart that demonstrates the money that has been allocated and that which is unallocated as of 6/10, which would include those that were enacted by the steering committee last week. As you can see, the Health and Human Services with PPE has 32% of the $1.25 billion, and that totals $405,600,000 approximately. Economic development still is at $148.4 million and 11%. Corrections is 1% at $500,000. We've reserved $250,000 for future needs later this year. That's 20% of the 1.25. Unallocated is 36%, and that is $447 million, okay? Could we go on to the next one? If we approve those that are on the agenda today, those numbers will change slightly. Unallocated will go down to $266 million. Education is added in there, and that'll be 2%. Well, I need to say that may change, but with the recommendation today, 2% is $28.2 million for education. That's higher education. We've included cities and counties at 12%, And that's a $150 million request from the cities and counties to be set aside. We'll discuss that a little later. So that's what it would look like if we approve all those that are on the agenda today. Okay, any questions? Secretary Smith, can we go to the next chart? We were asked to look at the funding that we have allocated to date and whether that money was being used within the public sector or the private sector. And Alan McVeigh at DFA has been working on this the last 2 or 3 days, working with the agencies that the money was allocated to. This is an approximate because this is what we believe the money will be spent toward, but not all of this has been spent. Actually, a small portion has been spent to date. We believe that it'll be around 27% on public in the agencies, the state agencies. And does that also include the cities and counties, or is that just state agencies?
State agencies includes the PPE.
Including the PPE, about 151 million, which would be 27%. The other 400 million that we spent today is going to private businesses like hospitals and doctors and et cetera. So that's kind of where we are today with regard to the expenditures, and I've included those that we are going to address later on, I guess, the next proposal.
Thank you. And I have one addition. I'll call on Cindy Gillespie to let us know about the proposal that she had a few weeks ago related to the foster parents. They have concluded dispensing all of those dollars, and they have about 111,000 that will come back to the CARES Act. So Secretary Gillespie, do you want to give us that exact figure? And then I know there will be communication back and forth with you and DFNA so that we can officially show those dollars back on our book.
Yes,
Sheila?
I am
Okay,
happy to. Yes, I'm on. Oh, sorry. Apologize. Am I still muted? Can you hear me? Okay, great. Thank you very much. We sent a letter, we talked to DFNA, who explained to us that when we had completed work, we would need to, for the monies to be returned and reallocated by the CARES Act committee, we would need to basically get approval from the CARES Act steering committee to do so. So I wanted to reach out to, I sent a note to Elizabeth, to Chairwoman Smith today. This is the caregiver payment for children in foster care, where we made a $500 payment to eligible foster families to help support the work that they were doing in May. We ended up dispersing a total of $1,087,500 in payments to 2,175 eligible foster families. This leaves $112,500 that we will not be dispersing. So we wanted to come before the steering committee to get approval for that to be returned and reallocated.
Thank you. We appreciate that. Do we need a motion for that, or do we just receive it back? Secretary Walther, would you like a formal motion on that, or do you want them just to distribute it back to?
She's asking you to make a motion on taking the $112,000.
Necessary, because we're going to be giving like a large amounts to other people, but only releasing it on an as-needed basis.
Yeah, I'm not sure if it requires I don't believe that it requires a formal vote by this committee. I think it is implied from the very beginning that any money not spent will be returned to the CARES funds. Let me check one. Lisa, do you agree with that? Yeah, well, my accounting people will agree with that.
Very good, thank you. And thank you, Secretary Gillespie. Now with that, you'll just have to adjust whatever numbers that, and he's seen $100,000 isn't gonna make, unfortunately, that big a difference on the change of our percentages. So I'd like to open it to the floor to see if anyone has questions of Secretary Walter or wants to have a discussion regarding where we are percentage-wise as to our current allocation. Senator Irvin, did you have something to say?
Yes, I just really appreciate it. I appreciate the work. That's really what I wanted to say. I mean, I had requested the breakdown of the public versus private sector spends because I think that's really important for the citizens of our state to understand and know that we're looking at, you know, not just using this funds for public purposes or public government, but also to help our private citizens. So thank you, Secretary Walter, for that, that work. I do have a question on the foster care kids. And I'm not sure if you know this, Director Gillespie. Do we know what percentage of our foster care kids possibly have been infected with COVID-19 or foster families that may be involved in that? Do you know that by chance?
I don't know it as a percentage. What I can tell you is we're tracking this every day in terms of the foster children or foster families that are either quarantined or have been found to be positive or who are recovered. It is an extremely, extremely small number.
Okay.
And so I was trying to think, it would not even rise to 1%.
Okay.
It's a very small number.
Okay, no, I was just curious about that. But again, thank you for the work, Secretary Walter. It's really good information and the charts that Elizabeth, that you know, all pulled together.
Thank you.
Thank you. Does anyone else have any questions or comments related to the charts and the discussion? No one here in the room. Representative Allen or anyone else on the phone?
No comment.
Well, I guess you can't see the charts right now, but hopefully you're able to view those.
I have my chart.
Great. Okay. Okay. Well, if there aren't any other questions, we will move on to our first proposal on the agenda is for both the Arkansas Department of Health and the University of Arkansas system. And we do have Dr. Smith and Stephanie Williams from the Department of Health on the line. I believe Stephanie will be presenting, and we have a wonderful group from the University of Arkansas system, President Dr. Don Bobbitt, as well as Dr. Gandy and Melissa Russ and Ben Beaumont in the room at the University of Arkansas system. So I will turn it over to, I think, Stephanie now. Go ahead. Mr. Walter, can you mute your microphone, please?
There you go.
Secretary Smith, this is
It
Stephanie.
is.
I think I'm unmuted now. Dr. Bobbitt and his team are actually going to talk about the proposal, and then I'm happy to assist and answer any questions.
Okay, Dr. Bobbitt, the floor is yours.
All right, well, thank you. And I appreciate the time, Secretary Smith and the committee members for having this opportunity to speak with you today. I want to start off by saying that this is a proposal with the Arkansas Department of Health and really all of higher education, not just the University of Arkansas system. And I'll explain why that's an important point in just a minute. But to set the table a little bit, I wanted this group to understand the work that preceded the proposal that you read today. The work really was conducted by Dr. Gandy from UMS and Melissa Russ, Ben Beaumont, and Maria Markham and our Arkansas Department of Higher Education. So if there are omissions in this proposal, they're mine. And if there's parts of it that you like a great deal, these individuals are the ones who did all the work. But to set the table, I want you to understand about this demographic that we need to both monitor, test, trace, and surveil. And this is a very challenging demographic. I've spent my entire life on college campuses. And you're going to find that, as we all remember from our time in college, this group is highly mobile. They will move from campus to campus, from community to community. They are invincible in the sense that they can handle almost anything. And they're highly social. And all three of those characteristics, which I think are certainly generalizations but not untrue, make it difficult for us to be able to keep our campuses open in the fall. And just to sort of put this in context of how precarious the situation is, if you remember what led to the shutdown of higher education this past spring, we had a positive COVID-19 patient at Jefferson Regional. That patient inadvertently exposed students not just from the University of Arkansas Pine Bluff, but also from CARC, the community college in Pine Bluff, the University of Arkansas at Monticello, nursing students from UAMS, respiratory therapy students from UAMS. And from that, 8 to 10 days later, higher education was shut down. And as you know, we're gearing up to be open this fall, and we simply are making plans that really we can't afford to have another shutdown. Some of our institutions can weather it, but we have great concern, particularly for our institutions located in highly rural areas, whether they would be able to weather through and push through another shutdown. So with that as the background, we met to look at what our solutions might be. And keeping in mind that we can't solve it for the University of Arkansas, we cannot solve it for ASU, we can't solve it for UCA, or for that matter, NWAC. We've got to solve it for higher ed. And why is that true? If you take a look at the northwest corner, you'll find out that there are students being exchanged on a daily basis between our campus in Fayetteville and NWAC. And I think if you take a look at Conway, we would find it hard to believe that we could keep Conway, the University of Central Arkansas, open if Hendricks were to close and vice versa. And if you look at any of our other communities, you will see the interrelatedness of sharing students and those students sharing social experiences on the weekends between campuses located in communities adjacent and sometimes quite some distance afar. So with that as a background, we looked upon this as a way perhaps to address testing, contact tracing, and eventually PPE purchases across all of higher ed. And with that in mind, you have the details of the proposal in front of you. I do want to give you some idea, though, of the magnitude of the task. If you take a look at higher education headcount, we're talking about somewhere north of 150 to 160,000 unique students that will be going in and on our campuses on a daily basis. Significant portion of them at our four-year schools will be residential in situations where it's difficult to maintain social distancing. And although we will require masks when that can't be maintained, it has been my experience that we don't always get our college students to follow every directive that authority gives. We'll be as diligent as we possibly can. And we have about 25,000 employees in higher education spread out across all the public and private institutions. So with that as the backdrop and the premise for why we were looking at this holistically across all of higher ed, we've taken a look at this and have decided that probably the best way to handle this is to try and deal with it for all institutions. Some of our institutions will be able to host an instrument and can provide an answer fairly quickly. And by the way, that's a very important characteristic, we think, for this demographic. I can imagine someone who is mildly or even hardly at all symptomatic agreeing to quarantine themselves for a limited period of time. I certainly can't see this demographic, based on my experience, quarantining for longer than a day, particularly when they don't feel poorly and they have other obligations, social obligations, and or other opportunities, for example, classes to attend. So we felt that getting an answer back to an individual, back to a campus quickly, back to our contact tracers so that they could begin the process of identifying other potentially vulnerable individuals, it was critical that this not be a process that take days, but really perhaps even hours. And so our proposal was designed around a particular instrument that is now available and under ideal conditions can produce an answer for us in 15 minutes approximately or less. Understand it has limitations, and we would have to develop protocols to deal with those limitations. But the hope would be that with those instruments in place and/or the participation of our partners at the Arkansas Department of Health, we could perhaps deal with this momentous problem across all of higher education. I want to talk very briefly about contact tracing. There have been suggestions made to us that this could be handled by volunteers on our campuses. And I have become very educated about this process thanks to Dr. Gandy and his colleagues. Really, there are a number of factors that suggest that at least in the beginning, I would trust professionals to be able to carry this out as thoroughly as it needs to be, absent even the fact that there is both HIPAA and FERPA protected information that they're going to have to deal with. So we have put in there a contract, reasonable contract that Dr. Gandy and his colleagues believe would allow us to begin the process in higher ed. If it turns out that volunteers are appropriate within the protocols that have been developed by these experts, then that course could be folded in. There will be opportunities on our campuses for volunteers to assist those who are quarantined by making sure that their needs are met, meals provided, other materials for classes conveyed to them safely. So we see this as something that's going to involve many individuals beyond even just the contact tracers to be able to open and remain open safely. And finally, with the PPE that we've put in there, we've tried to provide a reasonable estimate for the steering committee in terms of what we might expect as the needs. What we were hoping to avoid was the situation that this state encountered very early on when we were attempting to purchase PPE in a competitive market. And what we found under that circumstance was that those states that were prepared to offer more in terms of more resources in terms of PPE had PPE really redirected to them, even though we had commitments for it to come in this direction. We're trying to avoid that scenario in higher education in which our institutions maybe that were better resourced than others would be able to enter in a competitive market and win PPE, leaving some schools exposed. So again, by virtue of our partners with ADH and the Arkansas Department of Education, specifically the Department of Higher Education, we felt that there could be a way using some reasonable metric that these could be distributed. I would tell you that I have and want to thank our colleagues, Dr. Smith, Ms. Williams, and others at the Arkansas Department of Health. We asked a lot of questions. I didn't always get back my answers that were what I had hoped to hear, but I think what we got was what we needed to hear, and that was more useful, frankly, to us. They have a service mentality. I feel very comfortable that if this proposal is judged to have merit, that we'll have a very excellent partner. The one piece that we didn't address in the proposal is who makes the decisions, and I do believe that these shouldn't be decisions made by any one system, any one institution, and I feel that the governance of this particular endeavor could be handled, I haven't talked to him, but it could be handled by Secretary Ward's task force, which is specifically charged with looking at the issues it would take to open up higher education. The committee represents multiple systems, independent institutions, representation from private institutions of higher education, as well as from two-year institutions and the VOTEC side of education. So I feel comfortable that if we can move forward with that, with this proposal, that there would be both a reasonable partner and a good governance structure that we could tap into. And at that, I turn it back over to Ms. Williams and see what she would like to add to the conversation.
Stephanie? Ms. Williams? You're still on mute. Sorry.
Am I off mute now? I'm not sure. I still think I'm muted.
You're fine. Go ahead. We can hear you.
We
Okay,
can hear you.
So I think Dr. Bobbitt did a really good job walking through all the components, and we're really pleased that we have the partnership with higher ed and that they're thinking forward and really paying attention to the unique characteristics of our student population and how campuses operate and how they influence the communities where they're located. So we feel really good about the partnership moving forward, and hope that this allows us to maximize the supply chains for testing materials and also for PPE. We're happy to play a role in supporting the procurement of those items. And so if there are any questions, I'm happy to take those, but we're supportive and we're very eager to be a partner.
Thank you. I did receive one question, and I did get an answer, but I thought I would go ahead and address this, that UAMS has received funding for PPE for their staff members, which are also faculty. And so I just wanted to make sure that everyone understood that when we look at the proposal in relation to UAMS receiving funding, they're addressing only the students in the proposal for UAMS. I just wanted to make sure everybody understood that was clear.
Madam Secretary, I have a couple of questions.
Yes, Representative Allen, please go ahead.
Okay. I understand that they're asking for a little bit better than 28 million, and I think that this is a good proposal, but I do have a couple of questions that I really would like to have cleared up. There are a number of institutions, and I want to know how will the smaller institutions fare. For example, if we look at the institutions in the minority community like Shorter Baptist and Philander, as you know, this epidemic has hit the minority community the hardest. So how will these institutions be taken care of under this proposal?
I'd be glad to address it, and then Dr. Smith or Ms. Williams might want to add to it, or Dr. Gandy. But in order to host any of these diagnostic instruments, the institution's health center has to have the correct certification. And we have done a quick survey of higher education, and not every institution is going to be able to host one. Particularly the two-year institutions would not have the sophistication. But as we envision it, every one of our counties has a Department of Health office there. Some perhaps have laboratories, some do not. And I'll let the folks from ADH address that. But nonetheless, they would have a courier system, and samples would be transported to a testing site, wherever that might be, safely, so they could be analyzed. So we envision that the funds may have to be used to buy capacity within that system with the Arkansas Department of Health. And in fact, that's why that's probably the logical place that the funds would reside initially. And the experts there, along with our governance group, can make good decisions to make sure every one of our institutions has its needs met. The other thing I would point out is how, I'm sorry, go ahead.
No. So the money's not going to the institutions. It's going to go to the state health department, and the state health department is going to administer the testing, make sure that PPE is distributed to the various college institutions. Is that correct or not?
I would add to that, there are some institutions whose on-campus health facilities are sophisticated enough. They have full-time staff that includes MDs and other health professionals that they could host successfully one of these instruments. Other campuses, we would have to develop a partnership so that their needs could be met. In terms of PPE, it seems logical to me that buying it in larger quantities as opposed to one-offs is going to get us more equipment for the same expenditure of funds. And one of the things that we have suggested is that it would then be distributed based upon some metric that we could all agree upon, the task force could agree upon. One idea might be full-time equivalents. One might be SCH count. It could vary depending upon, what the task force decides is the most reasonable approach. And I don't know if Dr. Smith has anything to add to that, but that would be just one scenario is how they could be distributed fairly.
Okay. So the distribution has not been worked out. Is that what you're saying?
Yeah.
Representative Allen, this is Melissa Russ. Let me try to address what I think you asked originally, or a little earlier on. When we were working with the Department of Health as well as with DFNA, a question was raised as to how the appropriation would need to be addressed. And we talked through that particular process because one approach, which would be much more complicated, would be if the appropriation went to individual campuses. Now, that could conceivably work, but you would be talking about 33 campuses out of 52 because the remaining campuses are private institutions, higher education like Shorter and Philander and some of the others. And so in working with DFNA in particular, we felt like it made the most sense for the appropriation to actually reside with the Department of Health. And so the Department of Health would be able to assist us in procuring the testing instruments, the testing supplies, as well as the testing kits. They would also be able to assist us with the arrangement that they currently have in place with UAMS to expand the contact tracing protocol. And so that was 2/3 of the proposal, where the appropriation would reside with the Department of Health. And it made sense to us, given the supply chain setup that the Department of Health already had in place, that we would also have the appropriation for PPE to go to the Department of Health as well. And all of the appropriation then would be with the Department of Health. The department or the Division of Higher Education, for instance, would determine the amount that would be allocated of the $13 million that we've requested for PPE, that the Department of Higher Education, or Division of Higher Education, excuse me, would determine the amount that would be appropriate for each campus. And then there are some campuses that have purchased some small amounts of PPE. There are others that have not at all. And so we would utilize the pre-approved list from DFNA for PPE and be able to make those purchases in conjunction with the Department of Health. And we would determine through a mechanism how that would best be accomplished. I hope that answers your question. If I haven't hit on everything, if you'll let me know, I'll see if I can answer the remainder.
Thank you.
Thank you.
And Dr. Bobbitt.
We do have, I'm sorry, go ahead.
This is Dr. Smith. I'm happy to briefly review the testing strategy, but it looks like you've got a full agenda. If you'd like to move on, I can provide that information later.
Thank you. Does anyone need to hear that right now?
This is Senator Irvin. No, I mean, we can get that information, but I am interested to see, sorry, I think we could get that information later, but I am interested to see what the testing, are we testing everybody, and kind of the rollout or the timeline of that would be great at some point.
Yeah, this is Jay Gandy. No, we won't be testing all students as they return to campus. We will only be testing symptomatic students as they emerge.
I would add to that, if a positive is detected, then of course case investigation would involve testing both symptomatic and asymptomatic contacts.
Thank you. We do have a question here in the room. Representative Jean, go ahead.
Dr. Bobbitt, Lane Jean, I'm looking at your fall enrollment of 2018. I don't know why we didn't use 2019 numbers. You have 27,000 at the University of Arkansas. And I know it's the hardest thing to do to get a college president to predict what the enrollment for fall will be. What do y'all anticipate the enrollment to be under the current environment for the Fayetteville campus?
We actually have asked the campus that. They use a number of metrics to get a handle on that. As you pointed out, it's probably a number with a lot of uncertainty. They're expecting to be down no more than 400 to 600 students maximum, and it could even be quite a bit better than that. So they're fairly optimistic. Some of our institutions, our regional four-year campuses, are predicting larger decreases, although the deposits for residence halls, the individuals signing up for virtual orientation sessions doesn't seem to belay the decrease that they initially had predicted. So I wish I could give you a better answer than that right now, but at least in the case of Fayetteville, they're cautiously optimistic that they could be just down a small percentage from where they were last fall, and or perhaps even flat.
So I have a follow-up.
Yes, please, go ahead.
Well, a campus like UAM Monticello, have you seen what their projections are? More of a rural area setting?
They budgeted very conservatively when we put together our budgets for FY21, assuming to be down. I believe it might have been 4%. But in terms of the number of applications that they're processing right now and comparing them to past years, they're cautiously optimistic that they actually could beat that 4% reduction by quite a bit. So right now, it's so uncertain in the sense that if things continue as they are right now, relatively calm, particularly in terms of the cases flattening, thanks to the issues or I guess the actions that have been taken by a number of individuals, I think parents and students would feel more comfortable coming to our residential campuses, in which case they may be at their previous enrollments. If we see some big disruptions and public announcements of outbreaks, we might see the enrollments increase at our two-year campuses. This is not just U of A, but two-year campuses in general. People staying close to home, still continuing to maybe make progress toward completing their core with the intent that once the situation stabilizes, they would transfer. So right now, I think we're pivoting on the I guess the public perception of how the summer goes right now. But at least students have not been shy about sending in deposits and making other overt gestures that they're going to arrive in the fall.
All right. Thank you. Are there any other questions or do we have a motion related to this proposal?
I'll make a motion.
Representative Jean has a motion to approve this proposal.
Second.
Second by Dr. Bledsoe. Is there any discussion on the motion? No. Okay. I'll call for a vote. All those in favor?
Aye.
Aye. Aye.
Thank you. Any opposed? Thank you.
Okay.
Thank you.
Dr. Bobbitt, Stephanie, Ms. Williams, thank you so much. Your proposal to reopen higher education has passed. We appreciate it. You're welcome to stay on the line, but I'm sure you have other things that you would like to do. So y'all have a great evening, great afternoon. Thank you. Okay, our next proposal is also with a different campus for the University of, well, this is specifically for the University of Arkansas College of Engineering. And we have in the room with us Representative Andy Davis. Also, I believe Dr. Hale and Dr. Zhang are on the line. I think they will have called
we
in.
are. Yes.
Very good. Hello.
Hi.
I'll turn it over to you and let y'all go ahead with your presentation. Also, I believe Dr. McMullen is on, has probably, yes, I see he has called in too. So I'll just mute my line and then y'all go ahead and present your presentation. I'm excited to hear about it.
Hi.
Yeah, go ahead, Wen. You're the
Okay.
expert. It's all yours.
All right. Yes. Hi, everyone. I'm Wen Zhang. I'm from the College of Engineering, Civil Engineering in the University of Arkansas. So this proposal is really, we're trying to utilize the wastewater as a monitoring or a surveillance tool to look at this whole COVID-19 pandemic situation. So as you know, people who are carrying the virus, they can excrete it in their stools, and then that eventually will get into the wastewater. So in the raw wastewater, they're definitely there, and throughout the treatment, some might get degraded over time, but we're not really sure what the fate of the treatment is going to be. So what we are going to, or trying to do, is trying to sample the wastewater from different communities, especially the ones that were hit the most severe by this virus, and then trying to detect if they're, so what are the concentration of the virus, and hopefully can get an estimate about how much population is affected. And we have looked at different locations in the whole state of Arkansas, and I guess when I submitted the proposal, the numbers didn't look that bad, but I think the numbers now are a lot more compared to like a few weeks ago. So especially right now, not everyone is tested, and hopefully by looking at what's in the wastewater, we can get a better idea rather than having everyone go to the hospital to get tested. So that's pretty much the gist of the proposal. And I'm happy to answer any questions you have regarding like either the method we're going to use, or, or if you have any specific questions about the sampling locations we should go for, and I'm definitely open to suggestions as well.
Thank you. Does anyone have any questions? Dr. Bledsoe, yes. Here, let me give you a microphone.
Hey guys, can you guys hear me okay?
Yes.
So just really one question. The research publication, will this be in the public sphere, I'm assuming, so that the public could access this?
Yes, definitely.
Yes, definitely.
Okay, that's great. I think this is a great proposal as an aside, and I'm really, I'm impressed that you guys put this together, and I think it's very innovative, and hopefully it passes.
Oh, thank you.
Does anyone else have any questions? Representative Davis, would you like to say anything?
I'm going to talk. Just because I'm a politician, you think I'm going to
No.
Bill.
You're welcome to speak if you would like.
The only reason I'm here is some of you may have read, there's been a few news reports, other states and some cities like Houston are doing the sampling. And the idea is pretty straightforward, right? I mean, the virus is in your wastewater, we can test. We should be able to actually extrapolate out of the wastewater the sample results and tell you if infection rates in the city are increasing or decreasing. And so particularly when we first started talking about this and it was difficult to test individuals and we still can't test as many as we'd like, this is just another tool, I felt like, for the state to be able to monitor and probably even see in these results before you see an individual test results if a hotspot is developing. I reached out to Dr. Hale and said, hey, you guys have the stuff to do this? And he checked with Dr. Zhang and she said, yeah, we can do this. And I said, well, write up a proposal and we'll see if they'll bite. So that's how we got here. And I think it's a good way for the engineering department to kind of show off what they could do and to kind of support the state in this effort. And I appreciate you guys considering helping cover the cost.
Thank you. Well, I found it to be fascinating and interesting to think that we would be able to make these determinations from the wastewater, and knowing how long it takes for the testing to get tested for everyone, and then the expense of testing. I think this will be helpful, because your proposal is only $39,600.
Right.
Secretary Smith?
Yes, please go ahead.
Beg your pardon, did you recognize me or someone else? I don't know.
Recognize. Go ahead.
I would like to make a motion that we accept the proposal from the University of Arkansas School of Engineering for this study.
Thank you. Representative Gossett, or Mr. Gossett has made a second. Thank you.
I have a quick question. Sorry,
Go ahead.
I didn't get in. It's just a question for the presenters.
Yeah,
did they, and I don't have that proposal with me in front of me, but are they going to collaborate with the infectious disease folks? Is there collaboration involved with the Department of Health, or how exactly are we going to utilize that information? Will that lead to policy changes, or what are your thoughts?
Right. So we
information.
Yeah, we had talked with Dr. McMillan from the Department of Health. So this really depends on what we find. I guess the biggest challenge I see for this proposal is, because of the quantity of wastewater, and also when, the individuals who are affected get the virus into the wastewater, will we be able to detect or sample at the right time? So if, the results really turn out to be 50% of the wastewater we can get a concentration detected, then the next part of the conversation will be, how are we going to use this information, either to isolate the communities that are most affected, or what can we do about it? So right now we haven't tested the water yet, so I can't really promise we're definitely going to find this much virus in the wastewater. So I think that's a very good question. And also, I think I'll definitely need help from you folks, and trying to see how can we better utilize this information.
This is Richard.
Oh, sorry. Oh, go ahead, Dr. McMullen, please.
Yeah. So, I was glad that this proposal came before us, and I would highly recommend approval. I had there, CDC and EPA research and development. There's a lot of research going on in this area, and there'll be a lot. I was very glad to see this proposal, because it gives Arkansas an opportunity to, be on the forefront of research. And I'm willing to work with folks to help whatever needs to be done to, provide information as far as, cases and whatnot. So we're here, and we also have wastewater treatment facilities that are eager to participate.
Thank you. I really appreciate that. Thank you very much.
Thank you. And Dr. Bledsoe does have a comment.
Yeah, I just wanted to make one more comment about this. One of the reasons why I like this proposal is it's, first of all, not very expensive. But then secondly, the other thing is that it's a non-invasive way for policymakers to get information on their communities. It's not going to be, when you're talking about an outbreak or an epidemic, testing a patient gives you information about that patient. But when you test something general like wastewater, it doesn't give you that specific information, but it can be a harbinger of something that's more important, or something that's coming that could be very important. And it's an inexpensive, non-invasive way for people who are trying to decide how to handle these population outbreaks, to make some decisions and give a red flag that a community might be developing an outbreak before it really happens. To give you just one example of this, it's interesting what you can learn from a population by doing these non-invasive tests. I have a friend who's a toxicologist. He was asked to staff medical tents at concerts when they came to Chicago. And he began to get worried because there were a number of drug overdose patients that were coming to his medical tent, but the drugs would change depending on the type of concert. So he had his medical students, he got a proposal through, he had his medical students go and take samples from the porta potties during the different concerts, and he was able to publish a paper showing that people who go to Grateful Dead concerts, they take different drugs than people who go to Led Zeppelin concerts and people that go to Kiss concerts. And it's kind of a humorous thing, but what it did was it helped him plan for the type of resuscitation drugs and the type of things they might see before the concert. And so it actually helped respond to in a very targeted way to a potential population risk. So that's kind of what this is doing. It's not targeting an individual patient, but it gives public health officials and the community providers information in general that, hey, something might be going on and you need to take a look at it. And it's, very inexpensive and very, not a big allocation of resources for the amount of information that we could gain. So I really like this proposal. Thank you.
Does anyone have any questions? I know we have a motion and a second on the table. I just want to make sure if anybody had any questions before discussion before we go for a vote. Okay, I think we're ready for a vote. All those in favor say aye.
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 Any opposed? Thank you. Any opposed? Dr. Zhang, Dr. Hale, Dr. McMullen, Representative Davis, thank you. Your proposal has passed, and I'm looking forward to seeing what we find in our wastewater.
That's great. Thank you so much.
Steering committee.
Thank you all.
Thank you.
Thank you. Appreciate it.
Thanks.
See you, Andy.
Spot Bill's opposition.
Okay, so item C has been removed, and we are moving on to proposal by the Department of Energy and Environment, Secretary Becky Keogh. I think you need some IT equipment, so let's call on you.
Am I unmuted? Can you hear me?
Yes, we can hear you. Go ahead, please.
Okay, thank you. And based on that last proposal, I'm familiar with the work going on in Missouri with their Department of Natural Resources, similar to that research. So I'm happy to share some of that information with Representative Davis or the University Department of Civil Engineering, some of their sampling protocols and things. So if that would be helpful, I've shared that with the governor's office. So, and also we have teams out all around the state right now visiting these wastewater facilities. So please let us know how we can be part of your team and leverage our resources to support this research. So just offer that out if we can be on the helping side of that. But our proposal today is about, and I guess lastly, before I go into our proposal, I guess we just wanted to make the committee aware we are, as Energy and Department of Energy Environment, implementing what we call the LIHEAP program. And I know we've talked to the chair about this, but Low Income Home Energy Assistance Program. Arkansas is receiving a supplemental CARES money in addition to what y'all are discussing of about $8.2 million that will supplement current federal funds. So we're working on a process on how that will be public facing and assist the public. So I just want to mention that because that is ongoing work and is expected to be coming to the governor's office for concurrence and approval soon. The request today is about how we're continuing to do our ongoing work, both on the energy side and then the environment side. But as many of the other departments did, we transitioned to remote work in a matter of hours almost, or days actually, but I think people mentioned 2 to 3 days. What we found is, and this was important because we have a number of key work items that are required to protect public health, but also in response to the pandemic. So we've been working through that. To transition to the remote work status, we began to assess the technology that it would take and what to maintain as many of our operations, at least those critical, during the pandemic. And the first gap we found was in our saturation of laptop technology. So we did have a number of laptops available, and as a result of some of the grants that we received, we've been able to acquire those over time. However, we found that certain staff were lacking in that, and so we redeployed and prioritized the assets that we had to those that we thought were most critical. But we found that we needed additional technology to be able to allow folks to remote work and continue, particularly our inspection teams as they are going out in the field, being able to provide reports back. And some of our inspections, as I mentioned, have been those that are going to these wastewater treatment facilities early in the pandemic. In fact, our staff was, I don't know if Dr. Smith and those folks are still on the phone, but we were actually providing education to the operators out there on some of the health department guidance on social distancing and PPE requirements that they were not as familiar with. So our folks have tried to be an extra arm, if you will, to the health department initiative, but we are doing inspections. But it's important that we maintain eyes on those systems, not only for the employees of those systems, but the public. Also, I know that Secretary Walther and others are interested in economic recovery, and Secretary Preston, and one of our key programs is about permitting commercial changes, part of it, and making sure that we get that right, that authorization to construct, authorizations to operate for new economic opportunity or changes in economic opportunity. So our industry and our air permitting group was one that was particularly deficient in needing some of that technology. So we have moved forward, and we, of course, at the time we looked, there was a lack of available technology to purchase for a while, but that freed up, and we looked to see what assets are. And what we have done is actually acquired some of the laptops through our state permit fee funds. However, we're asking for reimbursement to make sure that those funds can be used for what they were intended to, which is to cover those key operating parts of our program. And again, we're asking that, I think we've asked for a grant to cover about, I believe it was 60 laptops that allow us. Going forward, we see that these laptops are going to be helpful in implementing other our on-site inspection program, similar to what we've learned from one of the agencies that became part of, one of the entities that became part of E&E, our Oil and Gas Commission, had been very effective at using laptops to have a more comprehensive and efficient inspection process. So we will be using these going forward as we bring people back into the office place. We will make sure those laptops are being used to make to further the reach of our inspection teams and be more cost effective as part of transformation. So that's my presentation. I would request that y'all consider this request and allow us to move forward with reimbursement of these costs back to the department.
Thank you, Secretary Keogh. I just wanted to make sure we got the estimated cost at $88,179.60 for the purchase of 60 laptops to be used in response to the coronavirus pandemic, and in order for your staff to be able to perform their work during this time, and that you would be receiving these pretty soon if you haven't already, in order to be able to work now and to perform those tasks you were talking about.
Right, we have received a portion of the delivery, but we continue to receive the rest.
Okay, great. Does anybody, I'm sorry, I interrupted you. Does anybody have any other questions? No.
Motion to approve.
Motion by Representative Jean to approve.
Second.
Second, is that Secretary Gillespie?
It is.
Thank you. Second by Secretary Gillespie. Any discussion? Okay, let's call for a vote. All those in favor?
Aye.
Aye.
Any opposed? No. Okay, thank you. Secretary Keogh, your motion has, your request has passed. Thank you very much. Okay, now for what we've been patiently waiting on. The cities and counties proposal is, let's see, Secretary Walther, I believe you would like to discuss the cities and counties proposal. We also have with us from the Arkansas Municipal League, Mr. Mark Hayes, and from the Association of Counties, Mr. Chris Beline. And they may have others on the line, but I think that's it. So I'll turn it over to Secretary Walther, and then I'm sure you'll have them speak as well. Thank you.
Thank you, Secretary Smith. I guess DFNA is presenting this probably because when we do start providing assistance to the cities and counties, the best place for that to focus in on would be DFA. We have an Office of Intergovernmental Services that administers grants on a daily basis, and so we believe that we're set up to accommodate the needs of the cities and counties as we go into this phase. Their request, I think, really we need to discuss the request to some degree, because they have within that request, they're looking to receive lost revenue replacement. That's one of the things. They know it's a problematic, but they've asked that, and so at this point in time, we don't have the ability to replace lost revenue, to my knowledge. There's also the issue with regard to FEMA and using CARES Act dollars to provide the 25% that FEMA requires the states to provide. We still haven't received confirmation, official confirmation, that is our ability to use CARES, use CARES to provide the 25%. So with that, having said that, we do have a request from the cities and counties. Mr. Hayes and Mr. Valines have written a joint letter to the CARES Committee outlining their thoughts in this area. They don't have any specific request at this time, but have asked that we set aside $150 million to address the needs of the counties. I don't know what percentage of the $150 million is attributable to the revenue replacement and the FEMA request, which may or may not happen. So I throw that out, and I just throw that out for discussion. I'm not sure what the actual number ought to be at this point in time. So I think it's something that the CARES Committee should, think long and hard about how we address the cities and counties.
Thank you, Secretary Walther. Mr. Hayes, Mr. Valines, would either of you like to go ahead and speak? And then I'm sure we'll have a live question for you.
Yeah, absolutely.
Go ahead.
Thank you. On behalf of the 500 cities and towns and the 75 counties in the state, we're very appreciative of the work the committee is doing, very appreciative of the comments from DFA. We are a little bit lost right now, unfortunately, because we don't get good data on sales tax monies for 60 days. It becomes very difficult for us to prognosticate just how far down the line we may be for revenue, recognizing too that the law is pretty clear right now that we can't get revenue replacement. However, there is a pretty substantial effort in DC right now to change that, or at least to amend the law in a way that would be more helpful in that regard. So there's a lot of unknowns for us. What I can tell you is this. We have some places that are already feeling substantial pain. If you'll take a look at just Eureka Springs alone, now admittedly it's pretty unique. They've got a tourist-based economy there, but they've already lost 18% of their revenue. As a result, they have 3 police officer positions open. They've got an EMS position open, and they only have 1 police officer patrolling the entire city during the day. When you think about that, along with some of the mandates that come along with us, for instance, the change in the FMLA law, the paid sick leave, where in the private sector, payroll tax credits are available. There's nothing available for cities and towns and counties. Those are just public expenditures that we just have to accept. So we know we're going to have some pain. We are doing everything in our power to gather as much data as we possibly can. We think the prudent thing to do is just set some money aside. We're not anywhere near the 45% that is recommended, that comparative number would be vastly different. We're asking for 150 million to be set aside, not to be given to us. We don't want anybody to get a windfall. We want to make absolutely certain that we're justified in asking for whatever dollars we may need. We're just not going to know that for a goodly while. With that said, if you followed the 45% rule, which is what's coming out of DC for local governments, that would be 562 million. That's an absurd amount of money, and we know that. I hope the 150 is high. I don't know that right now, and I fear we're not going to know it for a while. And that's the reason I think just from prudence, it makes sense to set it aside. And with that, Chris and I have got some other information to share, but I know Chris wants to make some opening comments as well. And then we're happy to continue on and obviously to answer questions. Chris?
Yeah, thank you. Thank you, Mark. I appreciate it. Director Hayes and I have been working together. Can you all hear me? Okay, good. Director Hayes and I have been working together for quite a while on trying to ascertain what the needs for cities and counties are going to be. And as he said, it's shooting at a moving target. And so we know we're not going to know for some time. But that being said, what's important for us is to partner with the CARES Committee to set aside. And I want to make one thing perfectly clear. Secretary Walther is right on. That money cannot be used for lost revenue. We're not asking for money to be transferred in any way yet. We're just simply asking the CARES Committee to take this portion of the money and set that aside while these things work themselves out. We do know that we can use CARES money at a city and county level to pay for our expenses. We actually have two different options on that. You can actually go the FEMA route and get those things paid for at a 75%, 25% match, or you could submit them to your state's CARES Committee and get 100% if the CARES Committee is willing to do that directly from them. We feel like it's in the best interest of Arkansas to go the FEMA route on those things that are allowable to be paid for by FEMA. I can't stress enough that the 45% guidance that was issued by the Treasury Department, I think it was last week, asking that states set aside 45% of their CARES Act money for local governments. That's more than we need. We know that now, even with the economic situation that we're looking at. And so I totally agree with some of the comments that Senator Ervin made that we need to be good fiduciaries of this money. We need to spend it where it can best be used. And the private sector is an important part of keeping the economy open. I have to compliment many of the people that sit on this committee, the governor. Part of the reason that we think cities and towns and counties are going to be able to survive this better than in some of the other states is simply because we've got a resilient, strong economy, and that's a credit to many of the people who sit on this committee. I'm going to look here and see. We do have some counties that are faring better than others. I'll give you an example of a couple of counties that are getting hit pretty hard. Union County's sales tax numbers from March were down 8.78% year over year. I believe Izard counties were down 10.10%. And then we have some other counties that are actually up. We don't know that the March numbers are a good indicator of what we're going to see going through the rest of the year. Counties are taking a hit from general turnback from the state, as is everyone. But they're also taking a hit on fuel turnback coming off of fuel sales around the state. The half-cent sales tax that goes to pay for our roads are getting hit. We don't know yet what's going to happen with the property taxes. We'll know later in the year if there's going to be a delay or many delinquencies in those. So with that said, I think I've covered a significant portion of this. Mark, do you have some things that you want to add in?
Just a couple of quick comments, if I might. One of the things that we know is that payroll is in fact reimbursable. The test services are rendered are substantially dedicated to mitigating or responding to COVID. So we know first line folks are having to do that. And in some instances, we know, and we're gathering more data about how much time they're investing in it, what that's meant to the workflow, whether some employees have gotten sick and gotten other employees sick. We're gathering information, and we know that some of that will be reimbursable. Unfortunately, again, when you talk about revenue, there's another side to the ledger. And that means we have to start cutting people. That means services get cut. And I mean, if you just use Eureka Springs, even minimally as an example, they're down to very few police officers to work in their city. So we don't want to get in those situations. What we want to do is get better data so that when we come back and ask for some of the 150, and I hope it won't be all of it, we'll be able to justify every nickel. No one wants cities and counties to face a windfall or in any way be abusive of the system. In fact, Chris and I have had several conversations where we have both agreed that our organizations and our staff that are already working a lot of hours on this issue could be used as some sort of clearinghouse for the committee to be able to batch information so that it wasn't a one-by-one request from cities. You'd be able to look at things in a better context. So I'll wrap up and then certainly stand for any questions. Chris mentioned a partnership with this committee. I see it very much that way. And this is, I think, the most conservative method to ensure that local government doesn't get hurt. We just want to stay healthy and keep doing the services that we're doing. And with some luck and some better numbers, hopefully, although some of the reports are not good on consumer indexes, maybe we can come back and say, hey, we don't need you to reserve that much. It's looking much better than we had hoped, but we just don't know right now. And so better safe than sorry. We also don't know what DC is going to do in the form of changing the law. So rather than asking you to give us anything right now, we're just asking you to set a little money aside to make sure that it's there when we need it. Happy to stand for questions.
Mark, this is Larry Walther.
Yes, sir.
I think it would be wise to take you up on, I think you mentioned this, but having to look at some of the things that y'all are dealing with today. Maybe we ought to be looking at some of the things that are pretty obvious that are reimbursable. So I would suggest that we get with you all and kind of talk our way through it and maybe start this process pretty quick, because we're already 3 months into the COVID-19 pandemic. And so we've got to have a sense of those dollars that are being spent within the cities that are dedicated to dealing with COVID-19 and how we can set up something that would be that would allow us to move rather quickly and provide that money back to the cities and counties. So I think we need to do that pretty quick.
I'm glad to hear you say that. We already have some surveys that have gone on for the last 4 or 5 weeks. So we've begun to gather some of that information. As you no doubt know, when in rural areas, sometimes the broadband conundrum is hard for us to gather information on a timely basis. But we are in the process of doing that, and we're working with the county association to get that as well.
Yeah, let me add to that too, Mark, if I could. Secretary Walther, we're still waiting to find out what some of the FEMA allowable expenses are going to be. So we're beginning to push on those buttons to find out what can be submitted and reimbursed.
Okay.
I have a question.
Okay. All right. Let's see. I heard Representative Allen, and then I did. Okay, go ahead, Representative Allen, and then was that?
Thank
ahead.
you. There's no doubt that there's a need for this for our cities and municipalities. My question is, how long do they want us to hold this money in reserve for them? What's your time frame?
Well, let me take a shot at that. So right now,
Okay.
we only have we're behind on knowing how much money will be coming in because it's a 60-day reporting process. So we won't know. We have March numbers, but we don't know what April and May will be. And with the spikes, we don't know what that's going to be. So I can tell you that what cities have done, and I think many counties have, they have stopped making purchases. They've gone into hiring freezes, and they have begun to set monies aside, fearing what may happen. But until we start feeling or seeing the actual data, we're not going to be able to answer that question. That's the dilemma that we're in. We're in a trick box, honestly.
Okay, so this is Mr. Hayes, this is Elizabeth Smith, and I know there's somebody else that has a question, but I'm going to go ahead and take the pleasure of the chair and ask myself first. And I think this goes along the lines of what Secretary Walter as well as Representative Allen mentioned. If you have cities or counties that have already paid out the extra pay related to the COVID required leave, or you have COVID payroll costs attributed to the pandemic, if you can identify those would be expenses that we would be able to approve those now. And I realize that you don't have the information for the month of May, but potentially you might have that information from April or the end of March even.
March.
Okay, but you wouldn't yet have it for April.
Not April, not May.
Okay, because those would be things that we could look at. And I realize that the reason that you're in this situation is based on COVID, which has caused the lost revenue. But we cannot simply just say you have X% of lost revenue, so here's a pot of money.
But we're not asking you to give us a pot of money.
Right, I understand that. What you've asked for us to do, though, is to set aside a portion of money and to wait, which I can understand that as well, so that we wouldn't allocate it somewhere else. But I just want you to understand where we're coming from, and I do like Secretary Walter's idea of trying to work with y'all to identify these, but it sounds like you've already sent out a request.
We have some
survey.
information, we do, and we'll begin that process of sharing it. As you might imagine, with 500 cities and towns and 75 counties, accounting systems are different, reporting systems are different. So it is, you start adding district court systems in. It sounds easy, it isn't. So we are gathering it. We will share it. We will absolutely try to get things boiled down where we can get some claims put in now. Chris and I have talked about that. The dilemma we're in is the one that I've explained. So. Right,
and I think that I would feel more comfortable having a better idea of what we think the actual cost would be. And then also to Representative Allen's comment that potentially if we had a particular date and time, but I see what you're saying that you may not know, this may be kind of a rolling, you may get rolling information. And so we may just have to sit down and consider how to handle that and how to deal with it. Because as you see today, we have already received money back that thought, DHS thought they would be able to spend, they wouldn't. So we're able to get it back, which is great, and we can put that in. But our drop dead date that we know right now is December 30th of this year, and we do not want to pass that date without having utilized the funds. Okay, so I think somebody else had a question. Did you have a comment after my?
Secretary Smith,
I completely understand.
Secretary Smith, this is Chris Valines again. I get the dilemma, and I think what we're not trying to do is lockbox money away so that if we get towards the end of the year, it could not be used for other purposes. I think Mark and I would be amenable to setting a fourth quarter date to release unspent funds, or at least meet with you guys again on that and discuss further, if that would help the committee. Mark, do you feel okay?
Absolutely, absolutely.
Let's go ahead, and I think there's some committee members that have more questions. I think, was that Representative Allen, are you trying to speak again? And then I think maybe Senator Urban.
Well, I don't have a problem, but it's kind of like we're letting them back into it. And I thought that this we should go forward instead of trying to back into it.
I understand.
My comment is that
go ahead.
If we had a proposal on the table, we could move forward. But what they're asking us to do, and really I don't have a problem with it, but what they're asking us to do is to hold it and let them back into it. Whereas everybody else that comes in front of the committee, they actually have a proposal, but they don't have one right now. And I don't have a problem with reserving the money, because all the cities and counties, they all deserve it. But I just think that they need to have something more concrete for us to take a look at than just set aside some money for an organization. I mean, set aside the money for cities and counties, and other people that come in front of the committee, they actually have a proposal.
Thank you, Representative Allen. I think, yes, Mr. Gossage. I think we have Senator Urban on that.
Yeah, Chris, Mark, do you have the details worked out with DFA about how this would be reimbursed if you do have allowable expenses? How would that process work?
I'll try that one, Mark.
Go ahead.
It's a great question, Representative Gossage. What we have been bouncing around is the idea of a subcommittee formed from some of your members and some city and county experts who could process and filter those expenses. What y'all don't need is to get bogged down in 575 different city and county governments coming before this committee requesting masks to be paid for or whatnot. So that's our thought process at this point. Of course, it would we would work with DFNA and get the right people from there on that subcommittee if they so choose, and go at it that way. Mark, you have anything to add?
I think that be clear about it.
So, I mean, I just wanted to see that, because for me, I'm really concerned about our water departments and our water supplies and the people that are operating those water systems. And if they go down, then you have a real mess on your hands, because we're not, operating that in rotational shifts and those kinds of things. So I really do support and believe that we need to do this. So if you can answer those questions, and then if we could look at some way of doing all of this and moving forward, I think that would be a great thing for the committee to do.
So
of setting some parameters.
Sure. The first question you asked about, of course, in Arkansas, there are no counties or cities that have 500,000 people, so there were no direct, no direct payouts. Right. My understanding is from the cities that have received monies under that criterion, that the expenditures have differed across the board, even within a state themselves, they've differed. So I don't have a great way to track that, although I can talk to National League of Cities and see if there's a way in which I could get some of that information. But anecdotally, in the calls that I've been on, it sounds like it's totally different wherever you may be. As far as the furloughing or layoff, or in some instances simply cutting positions, we wouldn't be able to tell you on the unemployment side. DFA or probably could, but certainly we have asked cities, and I guess this is really to your point, we've asked cities, Chris has asked counties to keep a laundry list of all that they are spending or not spending because they don't have the money, as the case may be. And I'm anticipating good information from that. What little bit we've already received has been pretty clear cut, like the Eureka Springs example that I gave earlier. So I think that does that answer your questions? Did I miss one?
Yeah, I mean, I'm just curious as to, how we're gonna, because there's this catch up with the sales tax and a delay in that reporting and kind of the uncertainty. So, it's a burden on our systems, one way or the other. It's becoming a burden. And so it would be nice to be able to kind of try to have that information, and then, also being able to utilize the ability to have technology where we may not have technology in some of our counties and some of our cities. And
That's
I think
the one I missed.
that's important to me, because I know, just like what we just approved for ADEQ, laptops to go out in the field and do that work. So that's a little hard maybe for a road crew person.
Well, but it's actually, there are great technologies available for street and road crews, and on the water and sewer side, the majority of those are done by local government. The vast majority are. And so, to your point, that's a critical supply, and all of these kind of services that cities provide, ambulances, firefighters, and police, and water and sewer, all of those things, and in particular right now, water and sewer, in light of the concerns that were voiced earlier. I never thought about porta potties being a study place, but I guess they can be. And so we do need that technology. I don't know what it is yet, because we haven't gotten that information.
Senator, this is Chris. I'd like to add one comment too. It's my understanding that some of the larger cities and counties across the country that have received that portion of revenue out of their state's CARES Act money, some of them are actually doing what we've talked about here today, and that is they're hanging on to a portion of that with the expectation that that CARES relief money use is going to be expanded. So they're just like us. They're watching several bills float through Congress right now, and including Congressman Crawford and Congressman Bacon's bill on the House end, that bipartisan bill that's out there right now. So to answer that part, I think we are seeing some of them withhold some of that money, just set it aside for that use, should it get passed up in DC.
Thank you. I know that we have a question from Representative Gray. So Representative Gray, can you hear us? Go ahead.
Yes, thank you. My question was just, I'm fine. I think setting the money aside as they gather their expenditures and work through it, I'm fine with that. I guess my question would be, could we not do the same with them that we've done with others? Just be a little bit different in that, set that aside, knowing that they'll use it in the fourth quarter, but in September, have them do an estimate to see, does it look like we're going to need 90,000, 120, 150? And that way, if we needed to free some up in that last quarter, we could.
I'm on board with that.
Yeah,
I think that makes great sense.
Okay.
I agree.
Yeah,
and I wanted to let I'm sorry. I think you're trying to make a motion. If I can go forward with this comment I'd like to make first. There is a proposal. Last week we approved $109.6 million for hospitals across the state, and that would include county hospitals. And then also we have a proposal that's in the works with EMS, so that could assist with, I know you've mentioned ambulance, so that might assist with the municipal EMS and that type of thing. So there may be some other ways that the CARES Act and the funding that we are looking at is addressing some of the needs that come from the cities and the counties. And so we do want to make sure that we can point those to you, so y'all aren't also trying to account, so that you know what we have covered.
Absolutely. That's a great idea. And if on the EMS side, if that does include municipalities, then we need to know that. My understanding is it didn't, but if it does, we absolutely need to see it.
Go ahead, Senator Urban, please.
Yeah, just following up on what Representative Gray said, if she's, making that into a motion, I would second that or make that motion.
Yes, I make that motion.
I'll second her
Okay,
motion.
Okay, can you restate your motion? I'm sorry, I didn't hear that as a motion when you were speaking, Representative Gray.
Yes, I make a motion that we approve the 150 million set aside to be spent in the fourth quarter, if necessary, as late as the fourth quarter, but have them come before us in September with an estimate of their needs for the fourth quarter, and any monies that they might not need could be put back into the fund to be spent.
I'll second that motion for Representative Gray.
Okay, Representative Gray, a motion and second by Senator Urban, and I think I have a question here by.
Well, we can go ahead and vote on that. I've got a
Representative.
separate question.
Okay, was there any discussion or questions related to this motion? Bill, did you?
That's good.
Okay, no. Does anyone have any questions? Representative Gray, are you still? I'm glad you
lowered my hand.
Okay. Anybody? I just want to make sure that anybody has any questions or discussion on the motion. Okay, well, let's go ahead and vote. All those in favor of approving the request to set aside $150 million until, I think you said the fourth, that would be spent during the fourth quarter, but that you would come back in September with an estimate of the actual need. Is that
correct?
Did I state that motion correctly? Okay. So all those in favor?
Aye.
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 Are there any opposed? Do we have any opposed?
Call out for the ayes again.
Let's call for the ayes again. I'm sorry, I think we had some that were still on mute and I didn't quite hear everyone. All those in favor?
Aye.
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 Okay, and any opposed? Okay, I think the motion passes. I think I heard at least 10, maybe 11 different voices. Thank you. I appreciate your presentation and your motion. And I would like to ask for the committee, I'd like to, before we close today, ask that we identify at least a couple of people to work with Secretary Walther as well as Mr. Hayes and Mr. Valines to identify those areas so that we will have a good estimate by September. So I'm appointing Secretary Walther. And is there anyone else who would like to join in on, I'm thinking maybe if we have 3 people from the committee, that would be helpful. Representative Jean, thank you. I appreciate that. And
So, I don't mind doing that as well. I know I'm working with Mr. Gossage and Mr. Preston on the broadband stuff. So, but if you need me, I'm available to help and assist with that, Chair Smith.
Thank you. Okay. Anyone else want to join in on that? Okay. Thank you. I appreciate that. Secretary Walther, Representative Jean, and Senator Irvin. We'll be looking forward to hearing from all of you. And then Representative Jean has a question not related to,
Well,
or maybe it is related, but.
before we lose Mark and Chris, these communities that have done these drive-through screenings, are y'all familiar with that? And was
Yes,
that
sir.
was that funded through FEMA, or they just did that on their own on the funding?
Well, the funding did, for the most part, the funding has not come from cities. So whether it came from FEMA or whether it came from outside sources, I'm not sure. But my understanding is, based on the conversations I've had, that cities did not put any or very little money into it.
So, and also the 75% FEMA, when we had cities, the first responders with the PPEs, fire departments and all that, that came from a lot of the FEMA money, right?
Yes, sir.
So, but they only got 75% reimbursement.
Yes,
So
sir. But
what we're doing here today will be eligible for the other 25%.
Absolutely, absolutely. And a lot of that's still in process. They put applications in, but FEMA doesn't exactly move with great swiftness.
Okay. But that would be identifiable dollars that we could look at.
Absolutely.
And Senator Irvin has another question. Oh, and Chris, I'm sorry, did you need to speak to that before?
Yes, please. Representative Jean, it's my understanding we've got a couple of counties that have actually paid for drive-through testing.
Okay.
Funded it in conjunction with the Department of Health. So.
Okay, thank you. Senator Irvin?
Yeah, I was just going to add to that there are some clinics that received direct federal money. There's whether it's through Medicare, but there was some direct federal money that went for testing to certain different federally qualified health centers or rural health clinics and things like that. So just information. Thanks.
Secretary Smith?
Yes, please go ahead, Secretary Gillespie.
Yes, I was just going to add that the drive-through testing is one of the areas that's we will reimburse through the allocations that will come down at the end of the month. So if the county hospitals were involved in that drive-through testing, when they make application and get their allocation in first part of July, they will be able to get, the counties will be able to get reimbursed through that. So we'll make sure that once we have the allocation requests from any of the county hospitals, that we pull those numbers together and give them to Secretary Walther so he'll know how much is going out to the counties through that.
Okay, thank you. Does anyone have anything else? We do need to make a determination of our next meeting date. We have, typically we meet on Wednesdays. Do we want to continue with that? I know the ALC meets next week on Friday.
Next Friday.
Okay. So Secretary Walther, will that give y'all enough time?
I'm right now, I'm not sure what we're going to have on the agenda, so I can't tell you.
Yeah, I'm sorry, this is Senator Irvin again. It's just, that's a question for Secretary Walther. I know Peer meets on Tuesday morning, so I'm just curious if we did have things, could we go through ALC exec subcommittee or just ALC as a group on Friday?
$28 million for Department of Health will be on the supplemental agenda.
Jake Bleed is in here with me. Why don't you, Jake is planning our peer meeting, so why don't you come over here?
We will be putting together a supplemental agenda for next week's ALC meeting based in part on the decisions that were made here today. The $28 million request from Department of Health in particular. And then we'll need to make a decision on the cities and the counties funding as well to make sure that they have appropriation for that. We eventually do make that funding. As far as next week's go, if we do get additional like an agenda in advance, we might be able to add something to the ALC agenda, but that would really depend on how the chairs feel.
Yeah, that was my
Madam
question.
Chairman?
If we approve, I mean, I know we have a broadband issue that I'm real interested in, but if we did approve something next Wednesday in this task force, would it be able to get ALC approved on Friday? Because if not, then it's pushing us all the way back to July. And I was just curious about that.
We have the broadband yet? I don't think we have the broadband request yet.
No, I know. But what I'm just saying is if whatever we have next week, would we be able to get it before ALC before Friday? If we had something that comes up next Wednesday at this meeting?
Senator, that would be up to the chairs. I mean, they can suspend the rules to consider supplemental agenda items. But
Okay.
it would be, I think, for them to determine.
Okay, thank you. That answered my question. Thank you, Secretary Smith.
I have a comment.
Go ahead, Representative Allen.
Okay. I just want to mention that we have a proposal forthcoming from a consortium over there in the Delta, and they called me today and said that it should be here by the weekend. So I just want to mention that.
Okay.
Oh,
Thank you, Ben.
is that for the CARES steering committee?
Yeah.
What's the nature of it?
I haven't seen it.
Okay.
Request for COVID relief from the Delta. Okay, here's, Bill Gossage has comments.
Dr. Bill Gossage or whatever you want,
Yeah,
Representative.
Representative, Dr.
Whatever I am. Had various names this week.
King Gossage.
I would just, Madam Chair, it's really going to be up to you, I think, to set the meeting for next week after you learn what's going to be on the agenda in consultation with the legislative branch. If DFA will figure out what day we need to meet next week, I think we should just encourage people to be prepared to meet Monday, Tuesday, or Wednesday at this point, and we'll figure it out between now and then.
Okay, I appreciate that. That's very helpful, and I think that I know it's going to be hard on the committee to juggle your schedules, but I think you know how important it is. And as Senator Irvin said, that the next ALC is not until July, so if we can get, and I know we have a number of proposals in the pipeline. I know I'm going on a little bit, but I did send out to all of you all of the requests that have been received as of, I think, Friday. Then I got another one. I think I've gotten 3 or 4 more over the last couple of days. So I will send you another. I'm trying to send you packets of them at a time so you're not peppered with email every day. And then we did get a couple of comments from our website. And I received a digest of that. There were 2 comments, so hopefully y'all are receiving those as well. And then as soon as we get from Representative Allen, send that out. So with that, unless anyone has anything else, we will adjourn. Good? All right. Thank you. Appreciate it.